Namaste and a very good afternoon to you all. I hope you all are having a nice time. After a long time, I am making this video with lot of encouragement from my friends, my fellow colleague, faculty members. I'm making this video. Almost every week, I receive a number of questions regarding endodontics through Facebook and other social media. Well, it is very difficult for me to answer all the questions, but I try my level best to answer through that media. So what I planned is like, why not I'll select the most commonly asked question and I'll try to make the video every Monday so that I'll get time on Saturday, which is our holiday, and then I'll prepare video for that. So today's question is regarding medical conditions and endodontics. Well, most of the times I'm being asked is like, sir, the patient is suffering from say such and such medical conditions. Is endodontic treatment safe, or we need to postpone, or we need to ask the physician before we start the endodontic treatment? So as we know that endodontics is almost safe in almost all the medical conditions, but there are certain conditions which needs to be either postponed or we may need to modify it to have a proper endodontic management. So in this video, I have listed almost 8 to 10 medical conditions in which in some of the conditions it's better we need to postpone it, and in some of the conditions you can start it safely. So I'll share the screen for that. The list of medical conditions, these are the conditions, this red block area, it's better to postpone certain conditions like unstable angina and myocardial infarct within the first 6 months. That is the recent history of myocardial infarct or unstable angina, because there is a chance of repetition of certain occurrence of the conditions. Meanwhile, the green block area like hypertensive patient, infective endocarditis, the patient who is under oral anticoagulation therapy, Hodgkin disease and breast cancer, you may need to modify and then you can start endodontic treatment. For example, in case of hypertensive patient, you can start with minimal concentration of adrenaline or without vasoconstriction. Likewise, in case of infective endocarditis, there are so many guidelines. We have to follow the recent guidelines, and if it is needed to prescribe prophylactic antibiotic, you have to check for patient compliance. If you feel like the patient is not having proper medication, you can give the antibiotic after the endodontic treatment is over. In case of patient under oral anticoagulation therapy, check for the INR value. If the patient is suffering from breast cancer or say Hodgkin disease, prophylactic antibiotic may be needed if there is developed risk of heart disease. In case of other conditions like diabetes, it is safe to do the endodontic treatment, but you need to monitor the glucose level. If the glycemic control is within limit, you can proceed for endodontic treatment, but make sure you are not pressing the limit. You have to take proper working length so that the periapical tissue is not touched in an improper way. Because as you know that in diabetes, the healing is impaired, you should take very good care about that. In case of pregnancy and breastfeeding, most of the time people get confused whether we can administer local anesthesia to a pregnant lady or not. So as far as we consider the recent literature as well as books, it is said that local anesthesia can be administered at any stage of pregnancy, and these are the list of drugs which can be given to a pregnant lady. In case of malignancy, if the patient complains of symptomatic non-vital teeth, it's better you do the treatment for root canal treatment and complete it 1 week before the patient go for chemotherapy or radiotherapy. And in case of the teeth which is asymptomatic, you can just delay the treatment. In case of HIV, look for the CD4 cell count. And for the patient who is having end stage disease of renal disease as well as who is under dialysis, it's better to do the endodontic treatment 1 day after the dialysis, because on the day of dialysis the patient is tired and there is a chance of bleeding. So these all are 8 to 10 conditions, but there may be number of conditions which we may not be aware of, right? So whenever we are confused, it's better you consult the physician, you have the dialogue with the physician, and then you can carry on with the endodontic treatment so that you won't land up with endodontic errors. So this is all about Monday questions. There may be other queries which you need to ask. Please write in the comment section, and I'll try my level best to answer that. And for today, this much. Thank you very much.